things.
So, I'd kind of like to, I guess I'll just stand.
Oh, here.
Usually you're gonna break, the desk is gonna collapse when she gets the chair out. I don't know why you don't anticipate.
I do. That's why I don't get upset when it happens now. I just expect everything to fall. Okay. So, Julie, what is HIPAA?
HIPAA is some garbage policy that protects patients' information from being out in the public, but it's not applicable to United Healthcare and Change Healthcare because they've dumped everyone's information into the dark web. Okay, that's the snarky version of what HIPAA is. HIPAA is, in the non-snarky version, is supposed to protect patients. However, if you do not publicly shame insurance companies and pharmacy benefit managers, you're not going to get any health care. I redact your name, my patients' names, and all their, their date of birth and whatever, their zip code or whatever is like a problem.
We also get a signed release form.
Yes, we also have a signed release form. I actually had gotten a cease and desist letter from Anthem, which actually was Primera. This was back when in Herald.
Okay,
days.
okay.
And I had a signed release form from the patient to use his stupid Anthem ID number. Like, they think that that's like next level.
That's like a social security card.
Yeah, like it's not. Nobody cares about your Anthem ID number, but thanks Primera, which is
for your
Amazon subsidiary company.
Hi, Maya.
So anyway, HIPAA is you're supposed to be protected from everyone knowing your business. The reality is everyone's business is all over the place anyway. So we do whatever we need to protect patients. If they don't want to advocate and they don't want their case publicly out there, no problem. I get a line of patients that do. So it's all about what you want.
What is a copay maximizer?
Okay, so a copay maximizer is a lever. Okay, a lever is a word salad, BS, buzzword bingo that pharmacy benefit managers and insurance companies come up with. A copay maximizer is a pharmacy benefit manager essentially triple dipping. They dip once because they're owned by the insurance company, so they're the supplier and the customer for the insurance company. Okay, so they get to sit on both sides of that fence. They get a piece of the sale, and they get a piece of the buy. A copay maximizer means that they're going to drain the assistance funds from the manufacturer, like the makers of the drugs that we use or the drugs anyone uses. And so they'll overcharge the card and drain it of assistance plans. And so by the end of the year, now Express Scripts in this case, Accredo, ICU, they're getting a piece of the buy, they're getting a piece of the sell, and now they're draining the assistance fund. So then they essentially make the patient uninsured, and the patient has, instead of having enough copay assistance to keep them in drug all year, they will run out of drug and copay assistance funds in like November. So the patient will have a $7,000-8,000 copay, and therefore they won't be able to get the money. They won't be able to get the drug. So this is just, maximizers are another way of a profit stream for the insurance companies and the PBMs to screw patients and taxpayers.
Well, there's currently a lawsuit from Johnson & Johnson, right?
Against Save on SP. Save on SP is a scam-o-rama. I actually have provided plenty of receipts to the J&J team because I hate Save on SP. It is a complete colossal waste of time for patients to get sucked into this, and it literally is a revenue stream of Express Scripts.
They're owned by Express Scripts. So
someone told me they are, but it was probably you, so I don't really know. I don't know that you run the numbers.
I feel like Wars told you too.
I don't know. It doesn't matter who owns Express or who owns Save on SP.
They're literally just draining the manufacturers.
Right. So Express Scripts, they like to say they are partnered with Save on SP. Partnered with, on the take, underneath the table, whatever you want to call it. It's a horrid relationship that harms patients. That's essentially what a copay maximizer is.
Well, and I wouldn't say that like our first call we start off snarky. It's usually when the patient hasn't had the medicine for a couple months and it's actually having an impact on their health.
I always lead with kindness, and I go real quick to flip because by the time it reaches my desk, it's gone through at least 4 people in this office or in my back office. So once they've wasted everyone's time, then let's buckle up and have a little Julie Bach time.
And in reference to the PhD TikTok, do you think there's a reason that they would use that acronym?
So PhD on what company was that?
That was Prime Therapeutics.
Prime Therapeutics is, again, another revenue stream of, I think Prime Therapeutics might be Aetna, but I'm not sure. They all have like all these subsidiaries that are just money-making machines. But Prime Therapeutics had an agent that said his title was PhD, like as in doctor, like doctor of psychology or doctorate of something. And it turns out it's called Pharmacy Help Desk. Like, whatever. That is why my primary title is the bathroom monitor, because I am a worker among workers in this office. And I actually do clean the bathroom.
So Savon gets a cut of money when the RX scripts sell the patient info, question mark?
Pretty much. So at every stage of the prescription adjudication, when they're getting the prescription, Express Scripts is standing there with their hand out. And Save on SP is just another lever of profits that are siphoned away from direct patient care into Express Scripts.
I have Express Scripts, and they are trying to make me go through every third party under the sun.
Of course they are. And here's the thing. They are the third party of the third party, and all of these, I call them interlopers. An interloper is someone who stands between the physician's office and the patient. And there's just a giant line. Take a number 64, Express Scripts, number 65, Save on SP. Like, it just, it's like going to the DMV without all your shit, and then you realize that all your shit says Express Scripts on it.
So you can legally deny their service, question mark?
Absolutely. So there's 2 ways to get out of Save RX. You can get your patient on the phone, and you can go through an hour's worth of questions because they act like they need to do all this.
He literally put us on hold for like 5 minutes just to ensure that she wanted to opt out.
Oh, I know.
He came back on and he goes, like, so are you sure you want to opt out?
Yeah.
And I go, you put me on hold for that?
Listen, it's or you can be a snarky biatch like me, and you can start tweeting out to Express Scripts, and you can have somebody help you. So we actually kind of hit this one on both sides of the coin. But this patient has been denied for 13 weeks, medicine for 13 weeks. We've had to supply her with physician samples. She's drained all the samples out of the office for the entire office because of Express Scripts. So yes, you can get rid of that Save on SP, but you have to make a phone call with the patient and go through all of their stupid questions.
Why do you think that they tell the patient, by opting out, you'll be responsible for the 30% coinsurance once your copay card runs out?
Because they're reading from a script, and 100% of that is not true.
No, I said that. Was like, what's the point of a prior authorization? Isn't the authorization that you guys will pay?
It's literally scamorama. Is Save on SP, Archimedes, Vivio, all of these interlopers are sitting in between. They're middlemen of middlemen.
Yes, this is why people say insurance is a scam. They lie all the time. They're like a terrible ex-boyfriend, and I know a terrible ex-boyfriend.
Yeah.
If I'm the patient, can I call and opt out? You have to.
Yes.
That's the only way to.
Yes.
Used to work at an optometry office, and patients would get denied dry eye meds after suffering for a year.
That tracks. Listen, health insurance in the United States of America is the biggest scam in the United States of America. We're all patients. We're all paying sky-high premiums. We're all being delayed and denied care. We're all being expected to make more co-insurance, co-payments. And for what? You get a big, fat nothing.
You get an email that says your employer got a rebate.
Yeah, of 50 cents. Right.
Middleman of middleman sounds like a Diddy party. It's gross. They're actually killing people. It's just as cruel and malicious because these companies are actually like withholding care. Your doctor's planned a treatment plan and they're now playing doctor. And who has time to call?
Well, we do.
Yeah, we do.
We have time to call because we make the time to call. And then we show it to you guys so you can see that, yeah, we will do the long hours and the long work on this, but I am not dealing with Save on SP.
Accredo is notorious in the rare disease world. If you opt out of the third party, how do you make Express Scripts pay and fill your RX?
So all you do is you opt out of Save on SP and you tell them you want to bill it on your commercial insurance, and you can still use a copay card. They make it sound like you have no options but to use Save on SP. Not true. Not true.
So Vivio is a scam. Going through the contract now.
Vivio? Oh yeah. I got into a giant argument with their CEO, Pramod John. And I actually was at a conference. We were at a conference in Nashville. Was that only last weekend?
That was last weekend.
Yeah, and I got into a giant argument with him. And I was scaring him to death. Like, you would have thought, like, I was like towering over him, you know, all 120 pounds of me. He had the Jimmy leg going. He was so nervous. I'm like, listen, he literally sat up there at this conference and lied and lied and lied. And I asked a question, several of them, and he talked about how he really wanted to have, oh, it is on our TikTok? Mm-hmm. Oh, perfect. Well, you guys can go see it. I asked, he's like, oh, well, communication is key. Really, Pramod John at Vivio? It's not key because you don't take my phone calls, you don't take my emails. He did give Claudia his cell phone number, and I will be texting him if I need him, but he doesn't. I've gotten an opt-out of Vivio. Vivio is no different than a Save on SP in the concept. They're a middleman of a middleman.
I'm so glad you're talking about this. It's so irritating how confusing all of this is for patients.
Yeah. Forget the middleman. Archimedes, gone. Vivio, gone. Save on SP, gone. All you have to do is have your physician's office help you, or we'll help you do it. Get on the phone with these people. Do not take no for an answer. Say, I do not want. I'm opting out, opting out, opting out. No matter what they say, you say opt out.
Wow, how is it legal for them to do that?
Because Express Scripts calls them a partner, despite the fact that who knows how any of this thing is legal. Express Scripts and all these, there's more lawyers in healthcare than physicians. I know that.
Y'all do amazing work. Watching you advocate for patients makes me want to cry. So many people don't care.
Well, we do care. We do care. We've got some really exciting stuff coming out. I saw this draft video. It's 6 minutes and 2 seconds, and it makes the hair stand up on my arms. It is so good, and
I haven't seen it. She's
you're
not allowed
in it.
To freaking
I'm in it. Dr. Bach's in it. The patients are in it. It is so good. It's so good. I have Aaron Brockovich vibes.
I work for an ER billing company, and there is so much corruption.
Total corruption.
You guys are amazing. Thank you for all that you do. I love that you guys fight so hard for people. We do, because our patients are our family.
And
we hate insurance.
And it's our Super Bowl.
It is.
Yeah.
When I can be snarky when both of us, because we have some good one-liners, and we're pretty quick to where they don't know what to do. And they're like,
And we wear fast shoes.
We need more providers like you guys. We need more advocates. And the more people we have advocating, the easier it'll be to make change.
I think change is a coming. Change is a coming because we all have this in common. Every one of us is a patient. Every one of us has been delayed or denied from our insurance company. And they get to sit back and not do a damn thing. I had a patient come up to me this morning in the infusion room. He goes, you guys are my favorite office. And I said, why is that? And he goes, first of all, you answer the phone and you work 5 days a week. Okay, do you understand how low the bar has dropped? We answer the phone and we work 5 days a week.
Oh, yeah.
Okay, but understand I have 24 people to support one physician. Like, that's expensive. And that's what's needed with the burdens of the insurance companies and the pharmacy benefit managers.
I try to advocate, but what I find is patients need to know what questions to ask.
Yeah, well...
They can't ask the questions if they don't understand what they're asking, though.
Yeah, I mean, it kind of just depends on what specialty you're in. I mean, rheumatology patients, they get educated real quick because if they don't advocate for themselves, they're going to go without care.
Right.
And every prescription, damn near every prescription we write here is expensive. So all of these pharmacy benefit managers want a piece of all of that every way.
How do you feel about the Federal Trade Commissioner suing the big 3 PBMs?
I love Lena Khan. She's a boss, and I hope whoever gets elected doesn't put her out. She is the best. She is for the people. She should actually be president, not these two we have
Please file grievances with insurance when you have these issues also. Well, we've found that sometimes when we try to file grievances, they come to us because the insurance companies
that
are
happened twice, okay? But you know what? We're gonna be helping a company launch their patient appeal stuff. It's launching like in 8 days. So we're gonna talk and show you guys how to do it, because you can do this too, and it's
we have 35 staff for 6 providers and only 3 infusion coordinators. There's no time to do it all.
No, there isn't.
We are drowning in prior authorizations, and no one believes we need more help in the office.
Of course not. Of course not.
No, 12 pages for methotrexate. Like, get out of here.
A $7 drug. We need 12 pages of nonsense. Yeah.
And Mark Cuban, I mean, your spirolactone was like a huge difference also. And it's just... What? It's all because these companies just want to make more money. It's the greed.
Right.
And the subsidiary upon subsidiary upon subsidiary.
Revenue streams of revenue streams.
Nurtec PAs are terrible. No, they don't ever get approved anyway. I think that's Boris is working on migraine. So, yeah. I mean, I feel like this was a great live. Does anyone have any last questions?
I have a question. What's for lunch?
I was back there. And it looked like Nikki G's.
Oh, I hope.
I just don't know what it was.
I'm hungry today. I went to the grocery store last night after I got my hair did, and I didn't have a quarter for a cart at Aldi, and I have a bad back, so I literally only was able to get a little bit of milk because I was going to have Cheerios for dinner, except by the time I got home, I only had cheese and crackers.
I work for a large health system as a UR infusion RN. Insurance is terrible. Carolyn is terrible.
Carolyn is careless.
Laura Garcia, if you ever want to know more inside info, we love inside info.
Yes.
Tell it all to us.
Send Claudia an email because we could use your help on some cases.
I want to know if Claudia's beautiful hair is getting on Julie's nerves today. Absolutely it is.
Claudia's beautiful hair was colored by Claudia, and I already reprimanded her about that.
Thank you, and keep fighting, ladies. Learn the game. Exclamation point is what Laura said. And then, what do I do if I can't get an urgent appointment with my doctor, the urgent care or ER can't resolve?
You need to find a good primary care.
Payer matrix is also terrible.
Payer matrix is another one that I have a full pass on. I actually, a couple of years ago, the CEO of Payer Matrix called me up and he goes, "Who in the hell do you think you are?" And I said, "Who in the hell do you think you are?" I said, "I'm not using you." And I've gotten a step through on Paramatrix, Vivio, Archimedes, Savon SP, Shark RX. Like, all of these are scam-oramas.
UHC Medicare Disadvantage, the worst. There's a reason health systems are dropping them.
Oh, yeah.
Haha, love it.
Yep.
I mean,
United Health Cartel.
What do you think is the biggest obstacle in the way right now? If you could change one thing in healthcare, what would it be?
I would get rid of the pharmacy benefit managers, and I'm looking straight at Express Scripts, Optum RX, and CVS Caremark. That's what I would do.
I fight with my insurance company every 60 days for my Biktarvy. It's so tiring. Yeah. The patients need to contact their employers that are enrolling in these trash funding programs.
100%.
But a lot of people don't have the confidence to. I mean, you're at U.S. Bank. Am I going to call up the owner and be like, "Hey, my insurance plan sucks"?
Not the owner. You're going to call up HR or the chief financial officer and say, "Hey, this is garbage." Most employers want the same. They want good health care for their employees, but they get bamboozled because they don't read the fine print into these things. So, all right.
Any issues with CVS Specialty Pharmacy?
Always, all different ways. I have issues with every single PBM.
Do you think we could have universal health care and get free insurance entirely? No.
No, and if we had universal health care in this country, it would be United Health Cartel, and nobody wants that. So
employers hate bad press. They do?
Yeah.
They do.
Well, guess who doesn't hate bad press? CVS Caremark, Express Scripts,
Optum RX. They blocked her.
They don't hate bad press.
Facts. All right, guys. So we'll be back later. We just wanted to come in, answer a few questions. Adi, are you looking forward to next year when they can not count the copay cards towards the deductible?
We'll cross that later.